Community Project Emergency Preparedness Plan by Nicole Durachinsky. School safety is of the utmost importance in most communities. This is especially true with the recent school shootings that have increased over the years. The importance of school safety extends to transportation, as bus drivers are often the first and last school employees to see a child during the day. A definition of a community. In order to properly understand a community, all aspects of that community must be scrutinized. Streetsboro is a small town in northeast Ohio. It is a community that is constantly growing, has a large retail industrial area on the north side of the city in close proximity to the Ohio Turnpike. The exit for the Turnpike also coincides with the end of I-480 that runs from Cleveland. This has created great access for the city for those living in northeast Ohio and other areas. It has a large retail and industrial area that's a mixture of both residential and rural residential areas. Streetsboro City Schools has 4 schools in the district. The schools are Streetsboro Elementary, Henry Duffer Intermediate, Streetsboro Middle School, and Streetsboro High School. Like many school systems, Streetsboro Schools has an emergency preparedness plan. However, this plan covers emergency situations largely related just to schools, and it has large deficits when it comes to transportation. It also fails to address children with special needs. You can gather a plethora of information from driving through a community and making observations. This is called a windshield survey. Below is a portion of the windshield survey of Streetsboro. The community assessment data. The overall health of residents of Streetsboro seems consistent with state, and several numbers were actually better. There is a high percentage of people that smoke at 40.5%. However, statewide, the percentage is 51.9%. One of the reasons so many people smoke is because cigarettes contain nicotine, and nicotine is mind-altering and a highly addictive substance. The mortality rate in the U.S. for smokers is 3 times higher than non-smokers. Another issue that negatively affects the health is poor diet. According to statistics, 54.7% of people in Streetsboro eat a healthy diet. That means the rest eat more unhealthy. There are several ways to improve diets, and some are community-based, such as schools have the ability to offer better choices for lunches, and there are also several government-based programs for communities to improve the overall nutritional health. Depression is another issue. When left untreated, can often result in suicide. The percentage of people in Streetsboro feeling down, depressed, or hopeless is 22.2%. It's difficult to come up with an accurate statistics on the morbidity of depression because suicide is usually the only cause of death that can be attributed to depression. For community partners and resources, the most important partnership for this project was the Director of Transportation for the city schools, which is Brandy Hollis. She's been in transportation for 12 years, and she was a bus driver for Hudson City Schools, and then she moved into the office as a router and a dispatcher. She just was recently hired as the Director of Transportation for Streetsboro, which neighbors Hudson. The second partnership is Amanda Hall. Mrs. Hall has lived in Streetsboro for 18 years. She became a driver for the schools 9 years ago, and she currently still is a driver. And most recently, she became a realtor in the area of Streetsboro with her husband, Tom. She has 3 children that attend Streetsboro schools, and that helps her with her insight and knowledge of how the school operates. There are many community assets and resources available, and when creating the plan, the police department was one resource that needed to be used. The police and the communication with the police is of the utmost importance in every aspect of the emergency preparedness plan. Another useful resource is the computer phone application that Streetsboro uses for their emergency plans for the school, and it's called Navigate Prepared. The nursing diagnosis comes together as a result of several parts. The parts of it are the risk of, and there's 3 different risks of listed for this. Among, and that's our community, which is the bus drivers, monitors, administrators, students riding on the bus, and the related to. It all comes together in one statement, and this is the nursing diagnosis statement. Ineffective coping among the bus drivers, monitors, students who are at risk of inadequate choices of prepared responses, inability to use available resources, and inability to react properly in stressful situations related to natural or human-made disasters, deficits in social support system, and inadequate disaster planning system. This is the goals and interventions portion of the nursing diagnosis care plan. The first statement is the goal, and below that are listed the interventions with the rationale for those interventions. This begins the actual emergency preparedness plan. First, we come to bus accidents. Bus accidents can happen at any time, and drivers need to have a basic awareness of the plan so they can do stuff in a proper order, which is listed below. In 2016, 3 buses in Streetsboro were in a serious accident with one another. The last bus rear-ended the middle bus, which rear-ended the first bus. 1 driver and 18 students were sent to the hospital as a result. 2 drivers are still out, and the driver that caused the accident has been terminated. Flooding is an issue that has come to light even in recent times. This past weekend there was a lot of rain in Northeast Ohio, and many cities had to deal with flooding. In one city in particular, Barberton, a driver drove into a flooded road with her bus, and the bus stalled. The children then had to be evacuated on an emergent basis. The picture shown on this slide is actually a road in Streetsboro that floods very frequently. Tornadoes. This is also something that, again, we were reminded of this weekend in Northeast Ohio. A couple of tornadoes were confirmed to have touched down, and several counties, including Stark, Portage, Summit County, were under tornado warnings. And this happened luckily on the weekend, but the drivers can be better prepared with this plan should it happen during school hours. The active shooter evacuation. This is an unfortunate circumstance that has become a reality. You never know when a kid is going to attempt to shoot a school, and due to this, it's better to be prepared for several different situations. Those situations include during times of drop-off in the morning, if an evacuation is needed during the day, and if a shooting is occurring during pickup in the afternoon. Again, chemical spills and terrorist threats are something that quite unfortunately just need to be addressed, because there is not a high likelihood, but a likelihood that these could happen. Chemical spills can happen anywhere, including in or around a school area, and at times there will be a need to evacuate. This covers that plan, and very similarly, the terrorist threat is a similar procedure. And in our country, we have been attacked by terrorists in the past. Hopefully we will not be in the future, but it's something we need to prepare for. In conclusion, it is important to remember the goal for emergency preparedness plans in regards to the nursing diagnosis of ineffective community coping. The bus drivers and monitors will be able to verbalize the important aspects of the emergency preparedness plan in order to verbalize a reduction of anxiety when facing an actual perceived threat, strengthen problem solving during a crisis, and be able to state a feeling of control in emergencies by the conclusion of completed education on the emergency preparedness plans. Preserving life, especially of children, should be the goal of any community and community health nurses. It is imperative to identify and use any resources available to handle emergency situations to the best of the ability of those involved. Thorough community assessment is necessary to formulate a proper diagnosis, goal, and interventions. The bus drivers, monitors, and director of transportation had the opportunity to participate in the creation of this plan, many knowing the district quite well. It was truly a community effort. Thank you.